Okay, let's just give it a moment just for people to make their way in. Let's just keep an eye out, see if a few people are making their way in, which I think they are doing, which is great. Okay, let's get started. So hi, everybody. Welcome to today's webinar focusing on the future of EU funding and research. So today we'll be diving into the European Commission's draft research framework for the next period of 2028 to 2034, it's a mouthful, and we'll be discussing the proposed changes and what they mean for your work specifically. We're all gathered here as pain researchers and advocates to explore the emerging challenges, the new opportunities, and obviously to share and discuss how we might be able to best position pain within evolving EU priorities. So my name's Nathan. I'll be your host today. We're joined by many of the individuals you might be able to see on your screen. You'll get to know those individuals throughout the session over the next sort of 90 minutes or so. I'd like to hear from you guys who are here. So pop into the chat, just say hello, welcome. Let us know where you're from, perhaps a little bit about your background. It's great to hear and see from everybody who's in the session. So before we start, if you aren't familiar with the webinar series that we deliver here at EFIC, these sessions are designed to be interactive. And today, we'd like to hear your thoughts about the upcoming EU funding proposal and perhaps how you think pain should be best positioned. There are a couple of ways that you can do this. There's a Q&A function at the bottom of your screen where you can submit questions. If you have specific ones, you can do that. You can also do this anonymously if you wish. I tend to do that in other sessions if it's a bit of a risque question, which we love. There's also a chat function where you can post general comments or thoughts that might not be a specific question that you want addressing. And of course, we'd love for you to engage in the webinar. And we have what I would consider quite a rare opportunity where we're all gathered in the same space at the same time. So I think we should take advantage of that. Now, in terms of addressing the questions, we'll save them right until the end to make sure that we have a fruitful discussion and our panelists, once they've shared their thoughts about the upcoming funding. I can see a couple of people mentioning Christopher Eccleston, Thomas is in the house, Rachel, Gary, is great to see you all. Thank you so much for being here. We're going to have, just before we get started with any specific presentations, I'm just going to go ahead and start sharing the screen. I'm hoping everybody bear with me, such as technology nowadays. Okay. Hopefully we can see that. If anybody on the panel is so nice enough to confirm that they can see that.
Yes.
Beautiful. Well, thank you, Patrice. Okay, great stuff. So I'm just going to quickly hand over to our President-elect Esther Pogatsky-Zahn is with us today. Welcome, Esther. We are looking forward to a few words from you. Welcome here.
Yeah, thanks so much, Nathan, and thanks, EFIC, for letting us do this seminar, and thanks everybody who is here on the panel and prepared for the seminar. Thanks for you participating in the seminar. I would like to welcome you as the president-elect for EFIC, and as you know, EFIC is very interested and keen to inform everybody related to possibilities to do and perform research to get known the system in Europe and of course, and this will be today about it, to get known changes that will be approached in the next near future by switching from Horizon Europe to the next level. And I just can see Luis here. He just arrived. I would immediately like to pass to Luis Garcia Larrea, who in fact is our current president, to welcome all of you as well. And you will hear from us later a little bit about EFIC's activity we did related to research priorities and approaches. So Luis, nice, and thanks for joining.
Thank you very much, Esther. You're perfectly entitled to welcome to everybody. I was on a train. The train was late, so just arrived. But I just end what Esther was starting. You know that in July, the European Commission proposed a budget, a big budget, bigger than the preceding, for what they call proposed the MFF, the Multi-Annual Financial Framework. And you know, no doubt, that this budget, which aims to finance the economic transition and supposedly strengthen the European Union sovereignty, has three big axes. One, which is more or less classic, the national and regional partnership. Another, which is also quite classic, is external policy. But another, which is new, which is competitiveness. And that this competitiveness merges 14 or 15 separate initiatives, including health and obviously research and pain. So we are embedded with something that is called competitiveness, and this is perhaps difficult to navigate. And this is the idea of this webinar, just to discuss, I hope interactively with you, the best way that we can find together to navigate this new landscape and to take profit for us and for the patients in pain. So I give back the word to either my next president, Esther, or to our chair, Nathan, who should be there.
Yeah, so the next, we will move forward with the program already. So thanks, Luis, and we are very happy that your train arrived on time. So thanks for being here. The next one will be Martha. Martha, would you mind? I know a lot of people know you for many activities within EFIC. So would you, just for those not knowing you, briefly with 2 sentences introduce yourself, and then please start with the policy process, which is quite an intense content. So Marta, please.
Okay, thank you very much, Esther. So yes, hello everyone. My name is Marta and I'm the Advocacy and Projects Officer at EFIC. And maybe to continue with our program, let me start by explaining the EU's budget process. So Nathan, if you could move the slide. Fantastic, thank you. Okay, so the EU's multi-annual financial framework, or the MFF, is essentially a 7-year spending plan, and it also sets the maximum amount that can be spent across different areas. So we have agriculture, defense, but also what's important for us, research and innovation. And for us, this is critical because Horizon Europe and its successor, so the 10th Framework Program for Research and Innovation, informally called FP10, are funded entirely through the MFF. Also, in the most recent 2028 and 34 draft, the Commission has also introduced new element, which is called the European Competitiveness Fund. And this fund brings together funding for research and also for health, biotech, and bioeconomy under this broader competitiveness heading. And maybe before we go further, I would also like to make a quick note. So you may notice that some slides still show Horizon Europe, even though we are talking about FP10. And the reason for that is that in the MFF draft documents, Horizon Europe is still used as a label for future research budget. So this also reflects the Commission's intention to actually retain the Horizon Europe name for the next framework program. But for now, FP10 is simply used as this shorthand used in discussions and planning until the program is formally adopted. If you could move the slide. Thank you. So yes, well, as we know, budgets are never just technical and they are often deeply political. And right now in Brussels, we have this moment of transition. We had the European elections in June last year, a new parliament was seated, and also the new commission is still defining many of its priorities. We also have different strong competing pressures. So for instance, the defense spending has risen sharply because of the war in Ukraine. Also at the same time, climate transition and energy security demand substantial funding. Also on the global stage, relations with the United States and China are pushing Europe towards so-called strategic autonomy. So this is the idea that the EU should be able to act independently in defense, technology, and trade. So of course, this translates into more investment in innovation and competitiveness. And finally, we have each member state who brings its own priorities. So council negotiations are always about balancing those national interests. If we could move on. Yes, so how does the timeline of the FP10 and MFF actually look like? So the Commission published its draft proposal in July this year, and now we enter this crucial 18th-month negotiation process between Parliament and Council. So the expectation is that the MFF and FP10 will be legally adopted in 2 years, with FP10 starting in January 2028. And for instance, for advocacy, the most decisive period is actually between now and 2027, because this is when strategic planning and work programs for FP10 are being drafted. So also this is when influencing the content of the next program is still possible. Because once those programs are adopted, the room to influence future priorities becomes much smaller. If we could move on. Yes, so, well, how likely is the draft actually able to survive those negotiations? It's a bit tricky. The MFF is adopted through a special legislative procedure that falls under the Treaty on the Functioning of the European Union. So that means that the Council must reach this anonymous agreement, and Parliament can give its consent but cannot propose amendments. So here the European Council guides big picture priorities like overall budget size and broad objectives. However, in contrast, for FP10, this is implemented under ordinary legislative procedure. So this is where Parliament has the power to propose amendments, adjust different funding allocations, and also influence thematic priorities. So understanding a difference here is a bit key, because especially for FP10's ordinary procedure, we can see that we can have some impact from stakeholders like scientific societies or patient organizations who can actually exert some influence. If we could move on. Yes, so we have 2 committees that are crucial here. And the first one is the ITRE committee, which covers research, and the budget committee, which looks at the overall budget. And within those committees, rapporteurs are appointed. So these are the members of the European Parliament, MEPs, responsible for steering the files through Parliament, and they can become key advocacy targets. Then Parliament can push for increases in research funding, highlight these specific thematic priorities, and also influence the balance of strategic planning. What's also important, that Parliament often coordinates with external stakeholders, so scientific societies, patient organizations, and this is where, for instance, our input can actually carry some weight. If we can move on. Yes. Yes. So the question is, how are other scientific societies or stakeholders responding to that proposal? Well, scientific societies are always quite quick to react to Commission proposals, and they often highlight those disease-specific research gaps. So, for instance, when the Commission published its MFF proposal in July, the European Cancer Organization issued a detailed response. So, for instance, they raised some concerns that health funding is now grouped under competitiveness heading, that also EU4Health no longer exists as a separate program, and that there are only limited references to cancer and health inequalities. However, at the same time, they pointed out to some opportunities. So that is recognizing workforce skills and productivity challenges, simplifying funding mechanisms, and also the potential for national plans to invest strategically in healthcare. So the lesson here is that while the Commission sets the draft, it's often the reaction of external stakeholders who work with MEPs that can help shape the final outcome. So, well, to sum up this part very briefly of the presentation, I think for now we can say that we learned that MFF sets the overall budget and defines how much can be spent on research, and FP10 sits within that envelope so that the total funding available and its broad priorities are shaped by MFF. Also, we know that the current draft shows strong ambitions, but also some risks, especially in how health is framed, and also that we have a bit of complex political context with many competing priorities. However, we also know that we enter this crucial 2-year advocacy window where Parliament has more influence on the draft, and also where the input from stakeholders actually can help shape the debate. So thank you very much for listening to me, and I'll pass to my colleagues.
Brilliant, Marta. Thank you. Eventually came back once I stopped the sharing. Thank you so much. That's a really, really interesting view. And I, if it's anything like I was when I first kind of saw this, it's a little bit unfamiliar for some researchers, and for some of our perspective, we might be more familiar with the part that's coming up next. So I would encourage that if anybody has any thoughts, any questions, please pop them into the Q&A or the chat, and we can address those later, because I think this is a really interesting context for us to consider. So we can go through that a little bit later. Now we are going to move on to the context of health research with Rebecca Lane. Can you share your screen? Are we there?
Can you see that there, Nathan?
Yes, perfect. Thank you so much.
Perfect. Thank you very much. My name is Rebecca Lane, and I've recently joined the research projects team at EFIC, and today I'll be walking you through the implications of this new MMF draft budget for those in health and pain research, so for all of us. So let's dive deeper into this multi-annual financial framework and its relevance to us as pain researchers. So firstly, I'd like to point you towards these two reference texts, the MFF legal text on the right and the more digestible fact sheets on the left, both of which are accessible via the QR codes on the screen. So let's begin by understanding the major structural shifts that are going to be happening with regards to EU funding. The European Commission, as Martha has alluded to, has proposed a new long-term EU budget that will radically reshape how funding is organised, especially for those in health and research. The most important structural shift is the creation of the European Competitiveness Fund, or the ECF. This is a fund which consolidates 14 existing programmes, including EU for Health, into one overarching structure. This structure will consist of 4 policy windows then, which I will go through in turn. So within this fund, health comes under one of these windows, and it's grouped in a broader sense alongside health, biotech, agriculture and bioeconomy. 2 other windows that are relevant to our field are digital leadership and resilience and security, defence industry and space. At the same time, Horizon Europe remains a standalone programme with a budget of €175 billion, but it is now more strategically aligned to this competitiveness agenda. A second key shift with this new budget is decentralisation. Around €865 billion will move into national and regional partnership plans, meaning that each EU member state will propose how they intend to use the funding. So overall, this is a more industrial, goal-oriented funding framework, with health funding no longer siloed, but instead part of a broader economic strategy. Now let's explore the logic behind this shift. Health and research are no longer being framed primarily as public goods, but instead as drivers of economic performance and strategic autonomy. This competitiveness logic is structured around 6 key focus points on which the EU's competitiveness relies. These are innovation capacity, skilled workforce, sustainable productivity, economic and social resilience, access to key technologies, and strategic autonomy. So going forward, any proposal, including those in health, will need to speak this language, and that's what we're going to start to reflect on as we progress through this section of the webinar. But we invite you now to start adding your suggestions for how you feel pain can fit this language in the chat function. One aspect of this budget that may be seen as a potential threat from our perspective in pain research is the absorption of EU for Health. EU for Health was the EU's dedicated health funding programme for 2021 to 2027, and it focused on 4 main goals. These were fostering health within the Union, preparing for crises, ensuring adequate access to medicines and medical devices, and finally, to ensuring health system resilience. It also included more targeted initiatives like the Healthier Together strategy, which you're surely familiar with, on non-communicable diseases, where pain had a small yet emerging presence. Under the new programme, EU for Health has been absorbed into this ECF, meaning that disease prevention, health system strengthening, and NCDs, including pain, are not explicitly listed at the programme level. However, this does not mean that there isn't other avenues through which pain research can be funded. They may be eligible under broader resilience or innovation funding priorities, or indeed embedded in national member state plans. It's not all negative by any means. There are many positive signals for health and pain research going forward, and many supports that are pre-existing but have been strengthened in this upcoming draft budget. So firstly, this new draft budget is retaining Horizon Europe, the EU's flagship research and innovation programme as we all know it, as a standalone programme, closely aligned to, but not completely merged with the European Competitiveness Fund. And we feel this may offer a slight bit more flexibility outside the competitiveness agenda, though saying that we should not forget this tight alignment with EU industrial goals that is the new focus of this budget. Retaining Horizon Europe will give continuity to academic research frameworks many of us are familiar with, and will preserve scientific excellence and project-based funding. So these are definitely positive signs and signals. Secondly, there will be enhanced support for researchers and innovators. The European Research Council and the European Innovation Council are being expanded with increased budget and visibility under the new framework. The ERC will promote even more excellence-led fundamental science, while the EIC will now have stronger links with strategic sectors like health tech and biotech. This will facilitate the scaling of projects from lab to market, and there has been specific mention of high-priority, ambitious innovation projects, which they have termed moonshots, and they've included some examples such as regenerative medicine therapies, digital infrastructures, and biomanufacturing platforms. Thirdly, the new procedures, as I'm sure you'll all be delighted to hear, will be simplified. The ECF funding schemes will now fall under a single unified rulebook, which will hopefully reduce the administrative burden associated with them, ultimately resulting in easier participation for us. Furthermore, more coherence between calls could also benefit interdisciplinary projects, for example, pain research that spans health, tech, and resilience. Finally, a stakeholder advisory board will be appointed by the European Commission to provide input into priority setting, to monitor implementation, and to help ensure that the funds are responsive to real-world innovation needs. So to reiterate, the implications of this budget for funding mechanisms for health and pain research are as follows. Horizon Europe remains a critical and familiar route for EU-wide pain research collaboration. The centralised EU for Health programme, however, has been absorbed into the European Competitiveness Fund, so it is now more likely that more funding will flow through the national and regional partnership plans. And while this may seem like a more novel avenue, it may be one that is more amenable to influence by researchers and their priorities. So to summarise, the EU's funding system is becoming more competitiveness aligned, more decentralised, and more strategic. While health and pain are relevant from the competitiveness agenda viewpoint, they are not obviously visible at the programme level, with the current budget documents showing little reference to non-communicable diseases, to pain, or to health inequalities. So the real challenge for us becomes, how do we argue that pain is relevant within the broader evolving landscape? And how do we proactively position pain within these new structures and priorities? So that's what we'll turn to next and where the discussions will go in this webinar. Let's start by reframing what we mean when we talk about pain. As we all know, pain is not just chronic, it's acute, post-surgical, cancer-related, injury-related. It runs across nearly every clinical area, intersecting with mental health, musculoskeletal conditions, rehabilitation, aging, workforce injury, non-communicable diseases, the list goes on. But here's the pinch point. While pain is everywhere in healthcare, it's almost nowhere in policy. And perhaps that is because it is so transversal. Yet, if we do not address pain, we're not going to meaningfully address recovery, productivity, or long-term well-being. The cost of pain does not stop at healthcare. As you all know, there is an economic and a societal impact too. As one of the biggest drivers of disability, healthcare use, and long-term absence from work, pain affects labour markets, social systems, and families as well. Pain also affects healthcare workers themselves. For example, musculoskeletal pain amongst nurses and carers contributing to burnout and staff shortages, as one example. This speaks directly to the resilience and productivity language of the new framework. If the EU is serious about system resilience and workforce retention, then pain must be part of this conversation. So how do we connect pain to the European Competitiveness Fund, bring it into part of this conversation? First, if we look to the resilience and bioeconomy windows, pain represents a core threat to health system stability, draining capacity, delaying recovery, and contributing to poorer long-term outcomes. Then in biotech and medtech, there's enormous scope. We're talking about innovation in diagnostics, regenerative therapies, neuromodulation, AI-based scoring tools, all of which align very closely with this window. With regards to digital leadership then, pain is also a strong candidate for wearables, remote monitoring, and digital self-management tools, a very clear use case for personalised digital health. So the fit is there. We just need to make sure that we make that case and that we make it clearly and consistently. So what could that case look like? Well, first, we could advocate pain as an amplifier, one that makes other diseases worse, one that delays recovery and blocks return to work. Secondly, we propose that we could present it as a systems-level challenge, one that cuts across care pathways, acknowledging that the solution cannot fit in one box. This makes pain a natural fit for digital health strategies and NCD reforms, utilising data standards like the ICD-11 and indeed integrating with the European health data space. One phrase we may want to use as a community is that pain and associated impairments are a cross-cutting priority for resilient, inclusive, and innovative health systems. We invite you to share your thoughts on this and any other further inclusion pathways you see for pain research within this broader framework in the chat section below. So to wrap this section up, the EU research and health funding landscape is undergoing a fundamental shift. Health is still present, but insofar as it drives economic competitiveness. Pain historically has struggled for visibility at the EU policy level, as you're all aware, but the truth is it actually fits this framework quite well. Pain impacts productivity, workforce health, innovation in tech, and system resilience. But that relevance will not be assumed. So we need to make a very clear and strategic case, not just in Brussels, but in how we can support national plans, shape research calls, and align with broader missions and societies. And that's what we're hoping to explore more together here today, and why your input is so valuable. So we really look forward to the discussions that are to come. Thank you very much.
Thanks so much, Rebecca. Another section comprehensive, lots of information that we appreciate the attendees will have to get their head around. There's time to do this, of course, but let's start the discussion. I think one of the core components certainly there is speaking the language of competitiveness and really understanding what that means moving forward. And of course, we can explore that a little bit later on. There's some comments coming through, some stuff in the chat from Johan, Rolf. Thank you so much. Let's get this discussion going. If anybody has any ideas, any thoughts, any controversies, we accept all of those. Let's get a good discussion going. And again, you can do that through the Q&A function or the chat, whichever you want to do. Let's move on to the final section. Much more information, really useful information to come. I'm going to hand over to Lewis, our president, who is going to cover a little bit on research policy. I'm going to share the slides, so Lewis will guide me through these, and hopefully it's super valuable for everybody. Thank you so much, Lewis. It's great.
Hello. I can take my slides if you like. Okay, you're putting yours.
No, I can share. I'll let you share yours. Let me.
Nice. I'll ask you. No problem.
Okay, brilliant. Let's go ahead with mine.
Okay, so go on with this. We come back down to the ground with science. You know that EFIC drove a pain research strategy for Europe. It was published in the EJP just in January this year, and of course this was not driven by some idea about what the European Union was going to evolve as you learn just in this webinar, but just trying to strengthen pain research and its implementation and reduce the societal, economic, and burden. But even so, there are a number of items in this purely research drive that can be useful for researchers and for clinicians to respond to calls, not only in a coordinated way, but also trying to adapt the priorities they are going to underscore to notions that have been endorsed by science. So I'll explain you very, very rapidly, because many of you are aware of this procedure. For the others, how this was performed, if you can go one slide, Nathan, please. This was a development relatively complex that started a bit as usual with literature searchers, with look in the literature also for the research strategies that had been developed by other associations on different aspects of pain and arthritis and psychological burden in neuropathic pain, etc., and also with expert rounds. And until now, this is relatively standard, was very well done. Thousands of papers and strategies monitored, and then this allowed to select from this 100 of potential priorities. And these potential priorities, you can go, Nathan. This and this is one of the points very innovative of this procedure, that these 100 priorities were submitted to individuals, to 1,000 individuals, pain researchers, pain clinicians, educators, universitaries, nurses, and all these responses were collected under a cross-sectional survey, which was submitted, of course, to vote, and which served to prioritize the priorities, if I might say. So from 100 things that were all theoretically important from the literature, what both the experts and the people working in pain research and in pain clinics consider as most important. And the result in the next slide, so this is a schema that you have already seen if you read the paper, but this means these are the 100 questions, and in green, those who were the most prioritized by the survey and by the experts, and in the red part is the less, and these are the axes which were qualified as either extremely important or important in more than 80% of responses. And you see that there are concepts that are very much down to the research ground. We were happy intellectually to see that understanding mechanisms was considered as a priority, which means that the community of pain researchers consider that without knowledge there is no cure. And this is important because 60% of the respondents were clinicians. So the clinicians are concerned with mechanisms. It is a bit less easy to understand this in terms of competitiveness, but we'll see it. And there are other notions and other words that even if the words pain and health or non-communicable diseases are absent from the European documents now in this new project, the words innovation and social resilience or sustainable actions or new technologies of autonomy, early treatments are included in this, because among these priorities, we found comorbidities, which is very, very easy to join when responding to a call to this notion that pain is intersecting and increasing mental health problems, increasing other kinds of conditions. So the fact that in these priorities we select the comorbidities of pain allows an avenue to introduce ideas in important calls. Of course, novel therapies and including the new technologies is something that is at the same time supported by this examination of what people consider and also can enter into the new framework. Of course, societal impact, which was very nice, and prediction and prevention. Prediction and prevention is a real avenue to enter into the calls by healthcare usage, disability, productivity loss, etc. So the issue now will be to collect and malax, which is science, which is intellectual, which is the knowledge that you all have in your respective fields and that you are trying to model to enter a specific frame that is performed and conceived by people who are not really in our field, and the avenues that these strategies are providing. Now, I can't have the next slide. And with this, I will do the transition toward Esther, who is with Brona Hulen very much working on the dissemination of this research. This is what we are trying to do now. Once the work of collecting the data and selecting priorities has been done, is how to target audience, how to target policymakers, how to target key opinion leaders, which means you, to fit these priorities into what should be the research during the next almost 10 years in pain research. So please, Esther, take the flame.
Thanks. Thanks a lot, Luis. What you have heard before is very well connected to each other. So PRICE, the project, it was in fact an ERA-NET project that was given to EFIC in a way that EFIC developed the research strategy, was just the beginning of something that, as Luis said, would allow now to do two things. One is to make clear that pain research is very important. So to raise awareness of pain research as an important tool. The second is to highlight what kind of pain research has the most priority, the highest priority, at least based on the votings of clinicians and researchers. And this was in fact discussed with patient representatives within the PRICE project as well. So based on the results of PRICE and by looking into the possibility to have this advocacy window, for example, for advocating for pain research within the EU, as you have heard from Rebecca and Marta, we are currently with an EFIC, and here the Brona has been mentioned. Daniel Campidi-Andrade needs to be mentioned here because he is part of the leadership group of pain research within EFIC. We are currently very strongly working on making PRICE, the results of the research agenda, visible and influencing, for example, politics and politicians. So we are currently doing activities related to pain research within many fields. As you can see here, the national and EU policymakers. We are using colleagues from different scientific fields to mingle and interact with them to make clear that, as Rebecca said, pain is already a joint venture with many other diseases, so it's relevant to many other diseases. Of course, we would like to reach key opinion leaders in pain research, like all of you here, to make clear that the priorities are more transmitted to everybody in the research field and used to, for example, in applications to the EU, that this is relevant topics. And of course, we are partnering with other societies to make sure that pain gets visible and what needs to be studied in the pain research field in the future. So what we are producing and what we are doing now is, of course, discussing with these people and making this visible. But we are, and maybe Nathan, you can go to the next slide, because this is a nice example of what has been produced by EFIC and the team. And the research group. This is on the right side, for example, an infographic which highlights the key messages of the research agenda. And it's made for a couple of different people. So we have one for politicians, we have one for patient representatives and advocates. We have one related for or very relevant for researchers. We will translate aspects and even the whole research agenda to different languages. This is currently ongoing work, and we, of course, will have already produced slide decks that can be used for those and from those that would like to make, together with us, the research agenda more publicly aware. And of course, we will need pain champions from other fields that transmit and translate and include pain in their research projects and agendas. And this is why we, of course, need to discuss with all of them the research agenda and prize results. Next slide. So, as I mentioned briefly, and we can discuss this further, is that we are currently strongly advocating for the for pain as a very important topic for research and research activities. And what we currently are targeting and doing is making prize accessible and relevant across the whole European area. We are mapping adjacent fields. We would like and will target communities where pain research can be integrated. And as probably, and I have seen some aspects in the chat already, questions arise are, how can we bring pain in research projects in the EU for new, I now say Horizon Europe, which will be called differently in the future, projects in the field of all aspects mentioned earlier by Rebecca and Marta. So we have opportunities there, and the research agenda, we think, can help us to bring this to the people and make better and clearer what pain and how pain is related to their different agendas which integrate pain as a topic. So next slide shows you what's coming next. So the activities we as EFIC will produce. So this is the first real webinar for making this more widely aware. We will do more webinars with partner societies where the prize content will be shared. We are currently already and will further link prize to promote within FP 10 and Horizon Europe advocacies. We are talking to MDPs. We had discussions with representatives from the EU Parliament already this year, and we will have the ZIP meeting, for example, and other aspects. And Patrice is here leading these activities, who will be further giving more important views for pain research and how to implement this in future research projects. And of course, we will engage with stakeholders, scientific societies, and policymakers. As I said, we are in fact in the middle of doing this already. We have this nice window where we can act and try to make pain visible and relevant, and we hope that this gives us all the opportunity, and you particularly, to form groups and develop projects that will then be positively evaluated from the EU Horizon FP10 program. So I think this will be enough for the beginning. Maybe I pass back to Nathan, who probably, and Melinda, thanks to Melinda, she's looking into the Q&A part already. I don't know if there's anything. Nathan, maybe you can let us know if there are direct questions to the audience here, to the panelists here from the audience, and we can discuss this further. Thanks to everybody.
Absolutely. Thank you, Esther. Thank you, Lewis. Very interesting stuff. I think there's a lot for us to discuss. And you mentioned there, Esther, that this is the start of the discussions. We have a nice window before this framework really comes into action. So we at EFIC want to make sure that we create a space for these discussions to be able to help position pain in the context of competitiveness, in the context of all the things that are important in the new funding scheme. And we could create a platform for that. And you might have seen that we've alluded to extra resources, extra sessions that are going to be held, and hopefully we can facilitate that discussion further past just the webinar that we have today, because we need as many people in this discussion as possible. So thank you so much. We have a few comments, a few points. Lewis, would you like me to come to you before we take it any further?
No. Yes, perhaps before we start with the real discussion, I would like to insist for, if some of the people in the audience have had this impression, that the thing that we should not be doing is to sell our soul. We are not selling anything. We are researchers, we are clinicians, we are involved in the most important thing that exists in life, which is taking care of the life of others. Full stop. So the problem now is that they have invented a kind of very particular way of asking for money and to allow us to work correctly with our peers. And what we need is, without losing our identity, without losing our soul, just to try to squeeze and to speak with words that make the others understand that what we are doing is also very important for competitiveness, for the future, for autonomy, for plenty of things. We are using other words in our common life. Now we have to malax them to turn with the others. But our work is our work, and we will not be moved, if I might say. So go, Nathan, please.
No, I think it's a very good point. And some of the things that have been spoken about, things like where we're trying to understand new concepts, and I say new, they might not be new necessarily, but things like innovation and social resilience and things. Is there a discussion that we could be transitioning just so we can position ourselves better but lose our identity, as you mentioned there, Lewis, when actually I think there might be something natural about that progression. Those type of things we might have been talking about for quite a while now. They just happen to be better positioned for the new funding scheme that's going to be coming. So fantastic point. And of course, if anyone has any comments to that, pop them into the chat. So before we go into some questions, I just want to give an opportunity to Patrice and Daniel, who are also in the call, just to give a very, very brief introduction to themselves. Thank you so much for being here. Your thoughts are going to be incredibly valuable. So maybe to Patrice, welcome.
Thank you very much indeed. We've heard fantastic talks. My name is Patrice Forget. I'm a professor of anesthesia and pain medicine in Aberdeen in the UK, but I'm also board member of EFIC, treasurer and chair of the advocacy committee, and we've heard so much about advocacy, reflecting different concepts about advocacy, but very interesting. I keep two important keywords that are directly challenging our views on what we do, and that may be, of course, seen as threats, but also opportunities. So first of all, we've seen during the last decades, the EU as a unique entity being assumed to be necessarily better because of centralized, while for different reasons, we're not going to be politicians this evening, but for different reasons, there is a decentralization process, a paradigm shift, and we have to consider that in our research, and that's quite clear in what we've heard about competitiveness, but strategic autonomy does mean what it does, and health delivery. So to respond that properly, we'll have to think about where does the sum of our different perspectives actually brings more than just the sum. So where we can work together synergistically. So that will be very interesting because it's fundamental to what we do, also at the ethic level, but definitely in research in particular. So that's the first. So how to accompany that to offer the best that we can do to address these needs identified by politicians. And the second important aspect, and that refers to a comment of Rolf de Kleef, is where do we think about quality of life, possibly mediating costs? And another comment about then mechanisms mediating effect on quality of life. So that's also fundamental, and I see that more as an opportunity than a threat, even though that can be challenging. So that will be interesting to see because we have very different perspectives tonight. So how to actually make that visible and readable by non-pain specialists.
Mm-hmm. Yeah, these are brilliant comments that are coming through, and of course these are insights that not everybody will have. So all these insights would be fantastic, and we'll bring that back into the conversation, I think, in a moment. Daniel, thank you so much for being here. Welcome.
Thanks for the invitation. It's a pleasure to be here. I'm Daniel Ciampi-Andrade. I'm a clinical neurologist. I work as an associate prof in the Center for Neuropersistent Pain in Aalborg, Denmark. And in EFIC, I've been helping with the research committee as vice chair, and also helping with the next congress in Glasgow. And I want to actually discuss and hear people talking because that's going to be the fun part. Everything that I say will be just having less time for discussion, but just to think about two things that came to my mind. Just like any other field, we think the thing we study is the most important thing in the world, right? And we are kind of right because pain is super important, but it would be nice to see how our headache colleagues, how our psychiatrist colleagues have their fields inserted in this framework. Because I haven't really gone into depth into this new framework and way to organize things, which is relatively, based on what I know from Horizon Europe, it's a fairly bold change, I think, in the way things are organized, very pragmatic, productivity, that's impressive. So it would be interesting to see how other fields are represented, because maybe we have a lot of allies. Maybe there's a lot of health-related societies or people interested in other fields who are also in this, show me that you are effective financially to play the game and reframe everything. So it could be that all the big societies are facing more or less the same thing. Or maybe it's not true. Maybe there are some exceptions, cancer, stroke, cardiovascular. But if you remove these big guys, I don't know, maybe headaches is also facing something interesting, and just like we are in could be partners to exchange, have common strategies to approach politicians. That's one thing. The second thing, which is a very smaller thing, with Esther, Luis, and all the EFIC team, we're also trying to make clear how EFIC can be a partner in proposals to EU. Not only EFIC itself, but also EFIC with Pain Alliance Europe, the patients organization, which is the largest patient organization of pain patients in Europe. And we're also thinking and trying to come up with new strategies on how we can facilitate proposals that are EU targeted using the right framing. So there's some products of this discussion that is about to come out, and we have been working a lot on this with Esther, Luis, and the whole team. So just these two things.
Yeah, very, very useful, very helpful, and insightful, of course, on how we can move forward for the future proposals, even considering EFIC as being part of that. I'd like to just kind of briefly move to Dan and Patrice giving a great oversight and your kind of initial thoughts on what we spoke about today. Maybe we can move to Esther and Luis, away from the content that we delivered in the presentation there. What are your thoughts about the new framework, the way that it's been kind of positioned, and how might pain be kind of positioned in that future sort of framework? How can pain become central? What are your thoughts about what we've spoken about so far today, Esther?
So yeah, good. Maybe it's a key question. Yeah. So one point to be made is one aspect that will be more important in the future than today, but it was already important today. And we are in the pain field not prepared to that. This is what money is. So how we influence money in the EU. So we do not have much data, but these data are currently coming out, for example, from a Norway study, what we save if we do prevention and treatment of pain, and what it costs to the community. Again, this is coming to the point Luis is saying, we are not selling ourselves, but we need the numbers to convince people that pain is relevant. Yeah? In the chat, Wolf Detlefs and Johan said, maybe quality of life is not anymore as important as money. This is not true for our patients, and we still should advocate for quality of life. But we really highly need numbers to present that we can compete with Alzheimer, depression, and other diseases, or even interact with them to make sure that what we are doing is relevant to the community. And we have missed that by being a little bit underestimating our potentials. Yeah, because as we know, low back pain is a huge driver for costs in the EU, but other pain diseases and pain aspects are as well. So this is one aspect we need to address. We need to address now to advocate that pain is relevant. And when we write grants and put people together for a grant, this needs to be in there, clearly stated. Yeah, and Luis, I mean, I pass to you to continue or even say something. Maybe you have a different opinion, but I think this is one point we always talk about quality of life, and we need to do that still. It's really important for our patients. But in addition to that, we need the numbers. You're muted, Luis, you're muted.
Okay, this is typical. I'm totally in line with you, Esther, and you know that. So I endorse what you just said. I would be to change my cap now and to become a bit technical, because if you read what the European Commission has produced in written, we see that finally it is perfectly possible to strengthen our ideas, including quality of life, but just taking their own words. They speak about disability and they must be in accordance with the specific objectives of the fund, which is a European Competitiveness Fund. So the new Horizon Europe, whatever the name they may, probably they will keep the name, but they will be very linked to competitiveness, which means that it should help to strengthen the European Union competitiveness, which means also the scientific and technological base of the European Union. If they speak with big words saying we are addressing global challenges or we are building on excellence, this means that they should be building on excellence in research and innovation. So what attracts me is that what the European Commission is proposing now is to almost double the Horizon Europe funding in the period 28 to 34 relative to what in 21-27. Even if not all the pillars of the Horizon Europe will benefit from the same, but globally, this budget now is passed from around 25 billion, if I remember well, to more than 40 or 44 or 45 billions now compared to the current program. So even the ERC budget will be expected to increase. So this means that at least one of the pillars, which is innovation, scientific innovation, is going to be seriously pushed by the Commission. And this gives back to the town. This reminds me of what the research priorities selected, which was pathophysiology, mechanisms, internal mechanisms, things that are on one word of the Commission, which is not only innovation, but is risk. They are supporting risky products. And this risk, if you mix risk and innovation and technology, you go back to also methodology and pathophysiology and mechanisms of disease. So I think that even sticking to the words they use, we can show very nicely that what we are doing goes in the same way.
And maybe just to add, because there is in the chat from Eja Kalsö a nice comment on resilience and prevention. And we know that some research projects were sent to the EU in Europe, Horizon Europe framework that were targeting prevention and resilience. And interestingly, in the first stage, they were very well positively agreed on. But at the end, in the second stage, they failed based on exactly the problem. We do not know at the moment how our preventive strategies will end up in numbers of reducing costs to the community. By looking into these numbers, you don't find much, but we need these numbers. We need the numbers to convince that our projects and that resilience and prevention is relevant. And we all know it's relevant, but we need to tell them how much it will help. And this is something we never think about. It's a totally different strategic thinking. Yeah. So this Eja is a very good idea, and many have already tried, or a couple of projects have been submitted, but at the end, a lot of them failed because other diseases were more and better able to give them an idea of the whole aspect, not only quality of life, not improving and preventing suffering, but by preventing money-wise the community, or gaining something for the community.
Mm-hmm. I think this is a good angle, and it really opens up the discussion. I can see a lot of stuff coming through in the chat. Feel free, by the way, our panelists, you might have an opportunity to reply in the chat because we have lots of things coming through. The idea for today is that we had sufficient time to go through, but I believe that since we're starting these discussions, there's going to be more and more ideas, which is really, really important. It's really good. So Esther, when you're thinking there about perhaps, taking a slant on this and thinking more about and I don't know if it links so much to Francisca's comment about, have we missed the opportunity in research that's happened so far? And I guess if we were to kind of go back to get what we want, is there an element of research waste and inefficiencies within that? Do we need to think about how can we capture something slightly different in a completely new, different way? What's your thoughts about that one?
So I think, but Fred is totally right. Yeah, this is a very great idea to partner, for example, with other groups that look at different diseases, sampling tissue, but not looking at any aspect that relates to pain, for just as an example. So this is thinking out of the box. Yeah, this is thinking different than we have thought before, having low back pain as the theme, doing what we think is relevant. So the out-of-box thing is to discuss with researchers from different areas, maybe, how we can increase the usefulness of research and research for the society. We never should forget that in EU-funded projects, research for the society to get more things out of such projects. So this needs to be probably what we all have said, that we need to advocate with other societies and research topic leadership ones that maybe have the same problems, as we, when looking into the new framework the EU is at the moment developing, like the cancer people. I mean, from our view, cancer is well funded, but they raise some difficulties with that new framework. So we probably should discuss with the other societies that are close to us how to interact here. So Luis, maybe you have some other ideas, or others here
Yes,
in
the research for the society is a very nice slogan. And I think that someone who take that in a next call. No, I was just telling you that I saw Gary McFarlane with a very interesting comment. I would like him to tell a bit more about what they are undertaking, because this is in the right line of what we are discussing. So Gary.
Yeah, brilliant. Gary, if you just want to pop that briefly into the chat, that will be really, really helpful. There's a few more questions and a few points. They haven't been lost if they've been there before. trying to keep it on track here. Esther, you mentioned briefly, and of course this opens up to Patrice, Dan, anybody who wants to kind of put in there. You mentioned about collaborating with wider groups and perhaps with variable specialities within perhaps proposals to address all matter of components. Stephanie says that not sure how to influence policy in Europe. Is that something that we should be doing? Or if it's not something that we should be doing directly, how can we go about doing that indirectly? You mentioned there about partnering with other societies to try and, build a more substantial message, I guess. Is that something that everybody here should be doing, aiming to influence policy in Europe? And if so, how can we do that to better position pain in what they're talking about?
So we are doing it with EFIC in the European Union. Like, as I said, we have discussions, and Sam is really, really active in this area, and including many of us in this activities, which are difficult in some ways to reach the people and to get the message in the right way to the right people, but this is ongoing work. But I think Stephanie's question relates more to the different countries. And this is an important point, I would say, because as we heard, money will be shifted to countries to make their own programs. So what we are doing within EFIC, as I said briefly, we are translating the price agenda to different languages, in very short versions for doing the political work in the countries. So this is one future plan that we will collaborate here with our chapters in the countries. Luis, we are very interactive. We have, in fact, already, or we are very connected with the chapters to help them. And here it's always, if you need us for more help, that's certainly possible for chapters to make policy in their countries. And here I would say the best strategy, as I know from Germany, is to go to your local society, the German or the French or the whatever chapter society, and patient advocates in the country. And those together should advocate for pain as a research topic. Maybe because Patrice has lots of experience in advocating, and in fact the next ZIP meeting is related to prevention, for example, showing that EFIC is very, very, for EFIC it's very, very clear that prevention is a big topic in the pain field. So maybe, Patrice, you have additional thoughts about that.
Yeah, of course, I can't agree more with you when you say that going together hand in hand with patients to make it concrete what we do believe in when think about quality of life and then competitiveness, but then getting back with the story of prevention, that's all quite obvious. Maybe that in the past we may have involved patient representative a little bit earlier in the process, but I think that we do that quite well from a number of years now at EFIC. So that's quite good, and that can definitely continue in that direction. Not only as a, let's say, top-down approach, which might be a strong word, but also as a bottom-up. So with nation-specific messages that may then echo again this strategic move of the strategic autonomy that's quite clearly and explicitly mentioned. So that's excellent as an idea, and then to all of you to insist on that, to think about what should we at national level do, but also regarding our specific perspective in a specific field of research, what we should do to enrich the perspective, and then to be sure that we're going with the right idea at the right moment for the right research question, and to be sure that it's explicit and that there is no discussion about mechanisms, quality of life, and then cost translation. Yes, Luis.
Patrice and Esther, of course you are right, but this, what you're talking about, is something essentially transversal. It's not just for us, for EFIC, it's not just for even for pain. I mean, but just if we stick to pain, this is definitely transversal, and I should say that we are relatively good at joining with other colleagues and other societies and other associations in some things, but we are really behind schedule and lobbying together. We do not know how to do that. And I think that we should learn to do that. I mean, advocacy, patient representatives, we are in EFIC, you are in EFIC struggling with this. Other people outside EFIC are also struggling with this in societies from anesthesiology, of neurology, of other people also involved in pain. And we do not know how to put all these people together and to influence the European institutions with that. We are still at the moment where we fight for our piece of cake, instead of considering that the cake is very big. We can all take our part, but our power will be much higher. Now we are discussing about another advocacy table on older people. I know that Patrice is going to participate. I know that probably Angela, so EFIC will be there, but they are doing the same job for paying older people. So why are not lobbying together?
Yeah, but Luis, I mean, maybe not everybody knows here, but we have the Pain Forum. EFIC has a Pain Forum, and the Pain Forum is a forum of other societies that meet under the umbrella of the EFIC community to discuss common themes. And we, in fact, are during the last years developed a couple of strategies advocating for opioids and very specific use with all the requirements for being safe and things like that. This were two papers in the recent past in European Journal of Pain by Winfried Häuser, led by Winfried Häuser. We had others, and we are currently, I mean, Price is an example of how Pain Forum members were integrated, and others as well. So I think, and currently, in fact, we have a couple of nice conversations with different societies, which turn into exactly what you mentioned. I think we are further than 10 years ago at the moment where we started this discussion. And I would say, and I pass to Daniel, because the research group is here very open to different fields, and we include many people in these strategies and disseminations. So I think, Luis, we in fact are not that isolated anymore. Yeah, but you are right. We should do this better than we did a couple years ago. Daniel, maybe you can say something about that.
We're not isolated, but we are, I think, still behind schedule. But moving forward, of course, Daniel, please.
Yeah, it's just a comment that Thomas made about fully agree on these strategic initiatives. When hopefully successful, we need some large strategic networks of partners to address the needs in grants. Any thoughts on how to form such networks along with influencing the program? So two different things, and I think EFIC can help a lot with putting people together. So EFIC itself being a partner, patients coming with EFIC, Warriors in Partnership, but also, I don't know to which extent we may, this just brainstorming, to which extent we may, for example, when we have some big proposals that EFIC is running, imagine something on primary pain prevention, which is something, primary prevention of pain. We don't have that many evidence-based strategies, if you think about it, primary pain prevention, except from general stuff that is common sense. We don't have a lot of any type of prevention if we remove some infections and uterus cancer in women and breast cancer, some very few types of cancer, some infectious disease. So it would be, imagine we could also couple these initiatives maybe to the Pain Forum or to networks we have with other societies. So it would be interesting if we have, let's say that we have a call for the new, I don't know the next name, Horizon Europe Stage 2, 2.0 for the next 7 years. And imagine that it's turning around a topic that there's one or two players, big consortia. We could work together. We could try to advocate together, maybe recruit connections. We have partnerships with companies. Some grants require that. We have partnerships with other societies. So I'm just thinking that it would be really another thing we could help with, making sure we can offer some wider network, even reaching, if you include Pain Forum, reaching the European Parliament. Just to add that.
Yeah, this is really interesting. I'm just a bit wary of the time. We have lots of things coming through and incredibly valuable. And I think this kind of reiterates that we need maybe a bigger platform, more time to discuss this. But thank you so much to the chat and everybody for sharing your thoughts. There are a couple of quick fire ones that I've picked out I'd like to quickly address just before we kind of round off. So this is kind of, I guess, addressed to anybody who might be able to share any insights. So Rolf, a little bit earlier on, asked if there would be more programs like ERANET Neuron, those type of national funding initiatives. Is that something that we will be seeing in the future framework? And is it more frequent, less frequent? How might that look in the next framework? I think it's difficult to perhaps attain, but maybe some insight, Esther or Lewis, from your experience with these types of calls. Are they something that we should be targeting as in terms of pain research?
So interestingly, for example, the ERANET call that came up was supported by some, but not all European countries. And this needs advocating in the countries. So a country may or may not support pain research in this ERANET funding scheme if they believe this is relevant or not. And this needs advocacy from the countryside, not at the moment where your country is not there. At the moment where we are now, where we have the possibility to have this window indicating that it is an important topic. So these more country-based, so ERANET does not look like country-based, but it is in a way that the countries decide how much money they put into these frameworks. And if they don't put anything, this country is out. So this needs advocacy in the countries.
Go ahead, Patrice.
There is a kind of willingness now, theoretically, on the paper, to decentralize the new Horizon. So this is written like that, but I know and I hear not from the competitiveness branch or pillar exactly, but for example, for the plan of national partenariat and regional. I know that they are asking to each country to develop a kind of budget and a kind of plan of partnership with others, which means 27 plans of partnerships. And I know that the different countries are very wary that this is a way of re-centralizing the budget, because the nation will not arrive to create themselves this partners. So there is now some fighting in another pillar. It's not our pillar of, but I know that there is discussing hard on this part of partnership. So I think that we should keep in mind that what has been written is that the things will be easier with less layers and more decentralized, going to each country. So take the step very rapidly to create ourselves these networks and present these networks ourselves, because there is this fear that if we do not do it, they are just waiting for us to re-centralize the funding.
Go ahead, Patrice.
I agree with these comments. So Louis' comments was welcome. There are countries where it's very well structured, others where it might be more difficult. That's why I see the social impact of pain platform of EFIC partnering with Pain Alliance Europe for the patient side as more useful than ever, maybe both at the European sites, continentally speaking, but also for helping and supporting national platforms. So SIP national platforms may be more useful than ever. And to echo Andrea's comments, indeed, partnering with others might be a very good way to expand the scope and to see and maybe to convince people at national level that investment in pain may be a winning game much further than that. Also learning from each other, and just echoing Gary McFarlane's comment, modeling the likely effect of different types of intervention at the UK level, but why not duplicating that kind of effort to convince people in other countries that that may be relevant, or maybe other interventions may be also differently relevant for different countries, but the methodology may be probably very interesting for others. So not to have to reinvent the wheel. So definitely together with, we are stronger than isolated by learning from each other, supporting each other. So I think that these were two quite decent examples. Thank you.
Yeah, brilliant. Thank you. And it really brings us to the aims of this discussion is really starting those discussions, bringing people in. I know, obviously, the representatives on the panelist or the panel today are EFIC, and we've obviously hosted this, but we want to take the discussion wider and bring in different entities to think about how we can really take advantage, as we've kind of reiterated, over the next couple of years or periods, certainly, to position ourselves as best as possible when it comes to the new framework being implemented. We hope that there's been huge value in the discussions. We haven't been able to get to all the comments and all the questions, so I apologize if there's anybody who we haven't quite addressed properly. If you feel it's burning, please keep an eye out. We are looking to see how this conversation goes, and it might be that we expand how we discuss in terms of more webinars, maybe even some other ways to increase and continue the discussion. So keep an eye out on that from the EFIC perspective, on social media, via the newsletters, the emails, the typical kind of process that we invite everybody. But I want to kind of close now, if possible. We have a couple minutes. I would like to take it to our president, Lewis, if you could have sort of the final word on what we're expecting over the next couple of years and how we can move forward in sort of the coming months and years.
Put me in a difficult, hard time here, Nathan. But first of all, I'm very, very happy that this first webinar has taken place as all the starting points, because I expect and I hope that there will be others and more refined. This first webinar is, of course, very general. We're discussing about generalities, about something that is going to be discussed in the next 2 years, and at times we are very vague. This is normal. So my expectations that we will have a series of this type of webinars, and every time there will be more focused, probably with themes. And this, I know that Nathan is already thinking about the different themes that we should take. And my expectations that we are, as Patrice was saying, and as the before, more and more prone to take from the others, to learn from the others, and not to be always aiming to be the chief in our goals and our projects, but to know that we are really closer to many things. And I would like to see projects that are taken not with one association, not to be just EFIC associated to the program, to be EFIC and another association of anesthesiologists and another association of neurologists, and all together with a common goal, without trying just to be the emperor of the call. This is what I would like to see in the 10 years to come. We are now just starting the way. Thanks very much, Nathan, to have put us together, and see you next time.
Brilliant. I hope we can continue this discussion, and please, anybody in the audience who's attended the webinar today, keep an eye out so that we can have these fruitful discussions continue. So that's pretty much takes us to the end of today's session. Again, thank you so much for contributing. We hope the information is going to be useful, of course, from the future consideration of EU funding. There's much more that we can discuss, and I'm sure there's lots of things that we've kind of missed today. So again, thanks to the guests that we've had today, Patrice, Dan, Lewis, Esther, Marta for the presentations, Rebecca for the presentations as well, everybody who's been involved. And I look forward to continuing the discussion. So I hope you have a fantastic rest of your day, and we shall see you next time. Thank you again, everyone.
Thanks, Nathan.
Thank you.